Well, peer pressure could be a big factor when it comes to drug use.
It's a concern with a lot of kids headed back to school now. Keeping your child from getting hooked on drugs, well, it starts early. News 8's medical reporter Jocelyn Mementa has her back tonight with some experts' tips. Jocelyn.
And Darren, to keep kids on the right track, the experts I spoke with say talk often, and the sooner the better. Do not make it a taboo subject.
When it comes to drugs and kids, take a direct approach.
One of the most important deterrents to drinking and substance abuse is parents giving a very clear message that it is not acceptable under any circumstances.
Patricia Reamer, who heads up the Behavioral Health Network at Hartford Healthcare, does admit that only works for some adolescents.
If you can keep your child from using any sort of substance, including nicotine, until they're 18, even if there's genetic loading in the family, 90% chance that your child will have less of a chance of ever becoming addicted later in life.
Surprisingly, kids crave structure.
They just don't feel their parents discipline them, believe it or not.
That's what Andy Buccaro with Project Courage hears from those he counsels.
That they just don't do enough, that they don't set limits, that when they do, they don't stick by them.
Do stick with the consequences. The conversations, they say, should start early, even before middle school.
There's very few people that don't have addiction in their family, and we know that there is some genetic loading with addiction. So pointing out to them that they're more at risk because of that, I think, is important.
Make it routine, different topics, different times.
Have a conversation about, you don't understand that when you're binge drinking, if you're a small, slight girl, your chances of really getting into trouble pretty quickly are high.
Pam Maudie, the director of the prevention program at BH Care, talks to elementary school students at a level they can understand.
Things like what's the difference between candy and medications at an elementary age, and making sure that they know that they only take medications from their parents.
Ask questions about their friends and their friends' parents.
Parents who are very engaged in their student's life or child's life and ask these questions ongoing and have these conversations, those students tend to not engage in the risky behavior and substance use as much.